Good morning, guys. Hope y'all are doing well. I hope you enjoyed a weekend full of great and exciting homecoming activities. This is Miss McLean, and I'm recording live from my guest bedroom, i.e., Shrine for Dak Prescott. Okay. Oh, and it's also my storage room. I didn't tell y'all that. I'm sorry. Anyway, gonna get this done ASAP because I've got a game to watch. Sorry for making y'all a little nauseous right now. Um, And we're so excited that Dak's going to be playing again today, and there's sure to be loud screaming at 136 Willow Oak. Anyway, today we're going to be talking about patient education and why it's so important and what a vital role it is to the quality of our patients' lives as far as long term health and mortality and morbidity. So I posted the chapter 25 let's see, PowerPoint for y'all. There was a lot of information in there, a lot of great information. So I encourage y'all to read it, especially those speaker notes, and look through your book. For the sake of time, because I only have an hour and a half today to get through two chapters and some really great and important information, I just kind of didn't go by the PowerPoint. I hope that's okay. So you can take some notes. This will be posted in Moodle for your continued review and watching pleasure. So have no fear if you don't get all the notes together. So we're going to start off with talking about patient education today and why it is so important and why we have to make sure we do it as a nurse and do it right. Um, it is the most important role of the nurse. Let's see, who do I want to pick on? Lauren Yin. Why is the role of education so important to the nurse? Does that make any sense? Okay, good. I'm glad you can understand what I was saying. It's a gift she has. Okay, great job. I'm sure your answer was wonderful. Everybody, let's give her a round of applause. Yay, Lauren. Being that I left her out of my previous recorded lecture, had to give her some props. So, another thing about patient education is it has to be individualized and tailored for each patient. The way that I learn best and the way that you learn best is completely and totally different. And it's important for us to keep that in mind when we're coming up with plans for our patients as far as education. So let's talk about why does education need to be individualized and tailored for each patient? Let's pick on Daman. Daman, tell us why our education for our patients has to be individualized and tailored. Okay, exceptional answer. Exceptional answer. Daman is always so good with all of our patients at the nursing home. They're going to really miss us a lot because she's not there to be so patient and loving with them. And another thing that we must not forget about patient education is it must be documented. Hey, Carl, why do you think we need to document what we teach our patients in the medical record? Okay, I'm sure you're exactly percent right because you're brilliant. It's so important for us to document what we teach our patients to provide a record of what we taught them. Just like sometimes as a nurse, some people's favorite response is, well, nobody told me that. Well, you tell a story. Okay, we probably told you that, but it's our way of saying, yes, we did. So it's really important to make sure we document it. So, one thing for us to really remember, and I'm going to make y'all sick again because I'm having to move the computer. I'm sorry. Um, Another thing that we have to remember is that education is more than just telling our patients what they need to know. We really have a job of making sure that we assess whether or not they're learning it. Because we can tell them all day what to do and how to take the best care of themselves, but if they don't understand it and aren't learning it, what we're doing is so we're just a waste of time. Um, it's very, very important to assess whether or not our patients are learning what we're teaching them. The role of the nurse in patient education as determined what we need to determine what the patient needs to know. We don't need to go into an hour and a half long spiel about type 2 diabetes if we're educating the patient on hypertension. We need to assess what they need to know. We need to assess their baseline knowledge. What do they know about hypertension? What do they need to know? Do they know anything at all? Are they clueless? It's so very important for us to determine what we need to tell our patients. We need to identify when the patient is ready to learn. That's very important, specifically after a very traumatic event, such as an amputation or a stroke or something of that nature. Traumatic times are not always the best immediately after those traumatic times to attempt to educate patients about what they need to know to go home. And we need to make sure that we're teaching information to the patient and also any of the stakeholders, any family, whoever the support person is going to be once they go home. It's important to make sure we're telling more than one person if at all possible. We have to make sure that these stakeholders and the patient have a deeper understanding because we want to promote autonomy. We want them to know enough so they can critically think through the information and know what they need to do. Specifically with like diabetes and congestive heart failure and COPD, we need to give them enough information so that they know exactly what they need to do if something goes wrong. I want to encourage y'all to check out slide number 6 in chapter 25. It's got a great picture of everything that I just told y'all. Okay, moving right along, we're going to be talking about the domains of learning. I'm more of a kinesthetic, audio, visual type. That's the way I like to talk about learning. But for the book's purposes, we have 3 different types. We have cognitive, affective, and psychomotor. Okay, now your cognitive, exactly what it sounds like. It's your critical thinking, giving them information that makes them think outside the box, that isn't necessarily black and white, that makes them make a choice that they have to process through. Affective learning domain is more seeing and hearing, letting people see it, like on a video or in a flyer, getting you to tell them, getting them to hear it. And then psychomotor is that hands-on. And I cannot tell y'all enough how important it is for patients to have that psychomotor part of learning. If we're teaching them how to check their blood sugar, if we're teaching them how to measure for ketones, if we are checking to see if they know how to check their weight on a scale every day, we've got to we've got to visualize them actually doing it to make sure they know how to do it. We think checking a finger stick is not a big deal. We think stepping on a scale is not a big deal. But for some of our patients, they just don't have the baseline knowledge that we do, and so we have to make sure that they're able to do that. We have to visualize them actually doing it, and it's also more meaningful for them. It's a great way for us to encourage them and give that positive feedback and deepen that relationship that we have with them. Long-term learning and application occurs when all 3 domains are used. It's a combination of all 3 that really hits that learning home, just like with y'all. Dr. Welch and I love to do lots of different things. I'm sitting here in a video that y'all are listening to. She will lecture. We do learning activities. All of that goes in to help y'all learn and really store away in here what we're teaching you. So we have to do the same for our patients. Again, think about how you learn best. What would you want to know? How would you want to learn? Those are great ways for you to really come up with great patient education opportunities. Now, for you young folks, all you millennials out there, it may be a little bit more challenging for you to educate your older generation patients just because their learning modalities are completely different than yours. But it's important just to ask and assess, if I'm going to do some teaching about congestive heart failure or hypertension, how best would that be for me to teach you about that? Do you want me to get you a video? Do you want me to give you a handout? How best is it for you to learn? We have to assess how our patients want to learn, just like with y'all. Okay, so moving on along, let's see. Let me look at my notes. there are 3 basic learning principles, okay? You have to have a motivation to learn, you have to have the ability to learn, and you have to have the right learning environment, okay? Y'all all know that pediatrics is my specialty, so I'm going to take a newly diagnosed 5-year-old with type 1 diabetes to use in this scenario of talking about basic learning principles to try to illustrate why these are important to assess and to look at. Motivation to learn. How do I know if a parent or a patient or a caregiver is ready to learn? Okay? How do you know that? Do they just tell you, I'm ready to learn now? No, they don't. You have to really look at the situation. You have to keep your ears open and your eyes open to really see and get those clues that they're ready to learn. If they're asking questions, well, what is that medicine you're giving me? Or why are we doing that? If they're wanting to take part in their care, can I do that dressing change the next time? And if they're accomplishing their daily care plan goals. A lot of hospitals have adopted the idea of a board on the wall of the patient's room where you set goals up, individualized goals for each day. If they're consistently meeting those goals, it's time to make sure that they're learning what they need to know to go home. Another important thing to know is to assess is how long is your patient going to be there. With the new DRGs and ICD-10 codes, insurances typically only pay for a certain set amount of days. So sometimes we have to hit the ground running. So it's important to anticipate how long your patient's going to be there. Okay, so motivation to learn, that's so important. Are they ready to learn? Do they want to know? What is their ability to learn? Okay, how do we assess that? How do we assess their ability to learn? When you walk into a patient's room, your first interaction with them, you're going to be able to know and start picking up on those cues of what their ability is to learn. Okay, you're going to, let's see, sorry. How do they answer questions? Do they give detailed information? Do they give little tidbits? Do they catch on quickly? When you're going through that admission assessment, here's the call light. This is the button that you press. The light for the overhead. It's the red light. This is at UMC in the Children's Hospital. The red light looks kind of scary. Nobody likes to touch it because it's red, but it's okay. It's going to turn that big light on over your head. These 2 lights by the wall are the light over the sink and the light down here at the bottom. And then your light over the bed is a little pull chain. If you go in 20 minutes later and they're sitting in the dark and you ask if would you like me to turn the light on for you? You can assess whether or not they're picking up on that type of information, okay? Do they seem engaged? Are they listening to you? Are they playing on their phone? Are they eating? Are they, playing a video game? That tells you what their ability is to learn. And also tells you, moving on to our next thing, our learning environment, how that's going to need to be set up. Okay, slide 15 has some great key things on how to make sure your learning is meaningful and what makes a good environment. So let's talk about in a situation, in a scenario. We have a patient, again, newly diagnosed, young kiddos, 5 years old, with type 1 diabetes. With those chronic conditions, specifically with children and even with adults, such as cancer or MS or Lou Gehrig's disease, they go through a stage of grieving because in this instance, their healthy child has died, and now they have a child that has chronic medical conditions, and it's hard for them. It's difficult. They grieve. They go through denial, anger. They go through all of that, and so it's important for us to assess that when we're thinking about when are we going to start teaching. Straight in the ICU and their kid's still trying to get corrected, their bicarb is still trying to get corrected, it's probably not the best time to be like, oh, hey, your kid's got type 1 diabetes. Let's sit down and go through this book about what type 1 diabetes is. Probably not the best time. Okay, so it's important to assess the learning environment. And when the patient's ready to learn, sometimes traumatic situations do tend to delay that readiness to learn. Again, slide 15, guys, look at that. That's a good slide. Okay, so moving on along, keys to successful patient. So I'm sorry if I keep making y'all sick by moving the camera. Keys to successful patient education. Um, and these are just things that I kind of came up with based off of the slides and just my personal experience. You have to establish trust with the patient. If you don't have trust with the patient, they're not going to listen to a word you say, nor are they going to believe you at all. You have to create an individualized plan. Um, you have to know what learning style is going to work best, what the social dynamics are. People, people, people. We cannot come up with this great, illustrious bells and whistles. Oh, they're going to use all these internet resources if they're living in the backwoods and they don't have internet. So you have to create an individualized plan. You need to know what their health literacy is. If they're a nurse, they're going to have a little bit more health literacy than, say, your high school dropout that's been working at a chemical plant. So it's important to know those socioeconomic components of your patient's care in order to create an individualized plan. Don't rush. That is the one thing I see a lot of nurses do. They wait to the very end, right before discharge, to do education, which is completely not the way it should be done. And then they rush. They don't allow return demonstration. They don't allow time for questions. They just hand you a piece of paper. They go over it and say, "Okay, well, let me know if you have any questions," and walk out the door. And that's just not the way it needs to be done. Be prepared to present the information on 3 different occasions. Okay, this is why I say discharge planning starts on admission. It really does. I thought they were really full of it for a long time, but once I finally got into the more complex patients, I realized it really does. You need to be able to present that information at least 3 times for most patients to really grasp what you're saying. Allow that return demonstration when at all possible. That really is going to solidify whether or not your teaching has been meaningful and when you need to refocus and reassess and re-demonstrate. Okay. Create a great learning environment. The 5-year-old with the new mom who's still with the mom who's still crying, you probably don't need to do patient education when his school friends are there at 3:30 in the afternoon, run around the room. Okay. You need to be able to pull mom out, pull dad out, grandmother, granddad, anybody else who's going to be providing care. Get them in a quiet room with a few distractions and really dive deep into that information. Okay, it's very, very important. You don't want to go through patient education when there are 14 visitors in the room. Okay, keep that in mind. The environment is very, very important. If we decided to have nursing school out on the quad every day, how many of y'all would be able to pay attention? Yeah, me either. Me either. I'd be staring at the birds, wanting a hammock, not sitting at my desk. So it's very important to make sure you create a great learning environment. Set realistic expectations. Your patient without a high school diploma is not going to be able to describe to you the pathophysiology of type 1 diabetes. Okay, they're just not. They're not going to. However, your patient's mom, who's a nurse or a nurse practitioner, they're going to have a lot more depth of knowledge, or your accountant or lawyer patient's parent is going to be able to grasp that a little bit better. Okay. Be prepared. Just like it's important for Dr. Welch and I to be prepared for lecture, it's important to walk in and be prepared. Make sure you have everything with you. Don't leave the room 2 or 3 times to go get, another handout or another demonstration box or something like that. Just bring it all in with you and just go through it continually, because if you leave, you lose their attention and then you have to regain it once you walk in the door. Okay. And allow for multiple opportunities to assess learning. Cannot stress this enough. You can't tell somebody one time and expect them to learn something. Okay? I'm not teaching y'all and then expecting y'all to never have to look at your book, never have to rewatch the lecture, never have to go over test questions in order to grasp these concepts. It takes multiple times. Okay? So that's keys for successful patient education: establishing trust, creating an individualized plan, not rushing, creating a great learning environment, setting realistic expectations, being prepared, and allowing for multiple opportunities to assess learning. Okay, so here's some of the common mistakes that I see people make that yours truly, as awesome as I am at being a nurse, has made as well. Sorry, my black screen came on. Okay, common mistakes, using big medical words. If they're not in healthcare, they're not going to understand shortness of breath or oliguria or let me think of some other big words. Urination or other, medical-y words, okay? You're going to need to use words like when you have a hard time catching your breath, when you go pee-pee. Y'all, I'm sure that probably caught y'all all off guard when I started talking like that because I just get in a habit of it because I want to make sure that what I'm familiar with is what my patients are going to be familiar with. When you say third spacing, do y'all even know what third spacing is? No. So neither is your patient. You're going to have to say, well, when your legs start swelling or becoming very tight and get bigger and you can touch them and your fingerprint's still in there, you need to let us know. That's the way that you get patients to understand what you're saying. Avoid big medical words. Don't go too fast. Assess as you go, just like I did at the beginning of the lecture. I told you the answer and then I asked the question, okay? That's a great concept with our patients. If they go, sorry, these are mistakes. Using big medical words, going too fast, not allowing for return demonstration, and then waiting to the last minute. Not a good idea. Okay, so that looks like the end of our lecture. Yay, 21 minutes and 47 seconds. Rocking it out today for patient documentation. So we have a group activity, which I'm sure y'all have all seen in Moodle because you glanced to see what all you needed to have for class today. And so basically what we're going to do is I'm going to get y'all to come up with just like a quick, 1, 2, 3, 4, 5 things that you would want to tell your patients about what problem you're being given, okay? If you'll pull up in Moodle, those of you who have your computer, there's a list of 10 things. What I want y'all to do is to number off just typical 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then restart over. I'm going to put y'all in different groups, somebody beside your clinical group. Put y'all all in groups 1 through 10. There should be about 5 or 6 people-ish per group. And then whatever your number was, if your number was 2, you look at the list and your problem is number 2. Okay? Super simple to understand. And so pull that up and look at it. Number off. I'm sure Miss Welch is in there making sure you aren't throwing a party during nursing school lecture. And then look at that. Some things, don't freak out. I know y'all are already pulling it up right now. Don't freak out if you're like, I don't know what this is. That's totally fine. This is not me telling you to create patient education. This is me trying to get y'all in the process of what would I need to tell my patient, okay? So there's a list of things just to kind of get you started about disease processes, what it is, what causes it, how can you prevent it, what happens if I don't take care of it, why is it important to care, and then medication, what is it, why am I taking it, how do I use it. Some people don't know how to use inhalers, some people don't know how to use nebulizers. What are the side effects? Can I prevent the side effects? Those are just simple questions just to get you started. So I want you to get in your little groups of 5 or 6, depending on how many people are there today, and just come up with some bullet points of what you'd want to know and what you would want to tell your patient about this problem. Okay? Guys, I hope y'all have a great, great, great time on your group work. I'll see y'all back when y'all get done. I'm thinking about 30 minutes. Well, really more about 15 minutes or so to get it together. And about 3 minutes per group to present. That'll cut the class in about half of our time for patient education, and then we'll whip out some documentation. Yay! See you soon.